Welcome to the Home Care Home-Based Video Training Center. This video includes information regarding the client medical record. Enjoy! First, the medical record can be accessed from the client visit screen. Simply by tapping the menu button at the bottom of your device, a series of tiles appear. One of these tiles includes the medical records. By tapping on Med Records, the user can view his or her recently seen or scheduled clients. By tapping on a client visit, view the medical record. In addition to history, a Features section is available outside of the client visit. Features allows a user to document information for IDG meetings, enter new orders, enter coordination notes, or input a supply requisition. These features again are available outside of a client visit. To minimize features, tap the gray arrow. To maximize history, tap the gray arrow next to history. An itemized list of medical record information is shown. The user can scroll to navigate the history section. Again, this screen includes view-only information. For example, we can view the contact information for this client by tapping on Contact. Here we can see all contacts, their relationship to the client, and any contact information that has been entered for these contacts. The user can return to the client medical record by tapping the back arrow at the bottom of the device or tapping this gray back arrow on the screen. In addition to contact information, we can also view the demographics. Within demographics, an itemized list of demographic information is shown. We can view all the demographic information at once, or individually tap on a demographic item to view solely that item. In this case, I will view all. Here we see personal info, address, payer source, diagnoses, and face-to-face encounter. Tap the back arrow at the bottom of the screen to return to demographics. Tap the back arrow again to return to the medical record. We can also view medications. Within medications, the clinician can check for drug interactions and utilize the education monograph for teaching. Tapping on Education Monograph shows the uses, side effects, and interactions for that particular type of medication. Tap the back arrow to return to medications. Tap the back arrow again to return to demographics. In addition, the clinician can view order history. Please note that orders in red denote wound care orders. For example, the 485 order does include wound care orders. By tapping on the date and time, the clinician can view that single order. Tap the back arrow to go back. In addition, the clinician may choose to view all orders at once. Tap the back gray arrow to return to the medical record. Next, we'll explore some features. For example, we may want to enter a coordination note outside of the visit. Add the coordination note, select the coordination note type, and tap on the text box to enter the note. A keyboard will appear. The clinician can enter the note via voice input, swipe, or tapping on the keyboard. Once the clinical note has been entered, tap the back arrow to save these changes. Tap the back arrow again to return to the medical record. In addition, medical records can also be accessed within the client visit. Please note, however, that when you minimize history, no Features section is available. Again, the Features section is only available outside of a client visit. This concludes the video regarding medical records.